everyone, it's Dr. Garza. Today for my Tuesday talk, I want to talk about how a registered dietitian works with our patients. So we have Leigh Anne Sullivan, who is a registered dietitian as part of our team at the McKinney office, and she is available to see patients of mine who I refer to her, but she's also available to see outside referrals and people and clients in the community that could benefit from her services. So a registered dietitian is a master's level clinician who helps guide patients through their diet and nutritional needs. She works with all kinds of different concerns and works one-on-one with patients to help them manage. One thing that we have a niche practice in is in the work of eating disorders, and I've mentioned that many times throughout social media posts. And so she is a direct care provider for the outpatient care of eating disorders. She does an initial assessment of patients and then helps them make the small changes that add up to big change in the recovery of eating disorders. That may be really taking baby steps as far as adding in more balance to their diet, making sure they're eating 3 meals a day, looking at foods that are fear-provoking and challenging for patients and finding ways to incorporate those foods. So there are eating disorders like anorexia, bulimia, and binge eating disorder that she works directly in caring for. And she also works with what's called atypical eating disorders. And these may be patients that have started off with dieting, where they learn about diets from friends or online or even from family, and then they may go through rapid weight loss that's unhealthy for their bodies, or they are having disordered ways of thinking about food and eating, where they're restricting, or they're restricting all day and then binging at night, or they will not eat in front of other people. And so we know that that affects how they feel, affects their functioning, and so those are issues that she can help with directly. So besides that type of work with eating disorders and disordered eating, she also helps patients with PCOS that need guidance on how to improve their diet. She helps patients with high cholesterol who also need some concrete ideas of how to make dietary changes that can improve their cholesterol. She helps patients with insulin resistance and prediabetes as far as how they should eat and changes they can make that will help them prevent those conditions. And I often will get questions about a balanced diet from my high school seniors that feel like they need more information before they head off to college, and so that is something that Leigh Anne can provide as well, really helping them understand what does a balanced snack look like, what do balanced meals look like, how to make good choices in the school cafeteria, how to make sure that their bodies are getting the adequate fuel and nutrition that they need. Another area that I find helpful with her work is working with student athletes. So I have many athletes that are in high school sports, they're in select sports, they may be in dance programs even that are very intense and requiring many hours per week of training and conditioning. And I think it's very important for them to understand what type of food they should be eating that will give them good fuel for their sport and for performance. And so a dietitian can help with that. Again, Leigh Anne is available for outside referrals. So if anybody that has a child, teen, or young adult who's interested or has concerns that I mentioned, she can be contacted directly, and her information is on our website. And also, I see patients on the medical side of the practice and refer to her when I feel like her input could help in the care of my patients. And so that's something that we partner together in caring for patients. And ultimately, our goal is for them to have healthier views of food and their bodies, and make sure that they're eating a good, balanced diet that provides adequate fuel for their bodies. So that's how a dietitian fits into our adolescent medicine practice.